Thank you for staying with Friday night. And before we close, today is World Sickle Cell Day. And this year, the theme is Break the Silence, Shine the Light on Sickle Cell Disease. Sadly, at least 200,000 children in Africa are born each year with sickle cell disease, while here in Kenya, it is estimated that 6,000 children are born with the disease. Sadly, between 50 to 80% of these children die before their 5th birthday. Since no known cure exists for sickle cell disease, the main goal is to prevent further complications due to sickle cell disease. And earlier today, the Ministry of Health highlighted the importance of persons who are living with sickle cell disease to be at that they are at even more risk of complications, and they were advised to be extra careful, to wear masks and practice proper social distancing during in-person activities. Tonight in studio, or rather tonight speaking live on a Skype to us, is Eunice Otieno. She's a sickle cell advocate and founder of the Sickle Cell Uhuru Trust. She was diagnosed with sickle cell at the age of 8 months. Today, she's 39 years old, and hers is indeed a testament that there is hope. We'll also be talking to Dr. Shikuku, that is a hematologist, who will be sharing about and demystifying around this particular disease, how to stay safe, especially during the COVID-19 pandemic. Thank you very much for joining us, guys. Let me start with you, Eunice. Walk us through your journey from as far as you can remember, your experience living with sickle cell disease. You were diagnosed at 8 months old. Today, you're 39 years old, so that's 3 decades later. Share with us your experience living through this disease.
Thank you very much, Lillian. As you have said, my name is Eunice Owino. I was diagnosed at the age of 8 months. And living with sickle cell, it has a lot of challenges. And being the fourth born in a family of 5, I thank God for my family and especially my parents for just understanding and walking me through sickle cell, and also just giving me the best health care they knew how to. And at the age of 13 is when I understood I have sickle cell, and even just to live with it and just manage it as possible. But growing up was very difficult because I was very tiny and very small. And those are the signs of sickle cell, which I know Dr. will explain more. And also just growing up and becoming an adult is when now you come to understand your body. And in Kenya, I can say we don't have the best health care. So right now, I can say is when the healthcare and the health system is now coming up, but we still need to do more. That's why I decided to do advocacy, just to also fight for the people who are being born with sickle cell and come up and be stronger, get better healthcare systems, and also just enjoy life because having sickle cell is not a death sentence. Having sickle cell, actually, it's just a blessing, where you need to understand your body, you need to do your checkups, you need always to hydrate yourself, and just the basic needs that any other person needs in this world.
And Eunice, speaking about understanding this condition at the age of 13, walk us through whether you have had or ever had a sickle cell crisis, and what happened, and how did you manage that particular crisis? If it happened.
Having sickle cell crisis is crazy. It's for women, I can say it's extra painful than labor. For a man is when they have flu and they feel like they want to die, but they're not going to die. So it's like a pain that you can't explain. It's a crushing pain where you feel like you're being cut. Like somebody is just taking a sharp knife and just cutting you. Because what happens is the sickle cells come and block themselves in your joints, every joint in your body. So during that time, your body is fighting. You end up lacking oxygen. You end up lacking blood, because now there's no flow of blood and oxygen in your body. So
Right.
that time is the time you need to be rushed to hospital. You need to be treated as an emergency. Then you need to be given a painkiller, something like morphine or even tramadol, just to make sure that the pain has gone. Once the pain has gone, the doctors need to find out how to they need to find out what is causing you to have that pain. Is it that you becoming anemic? Is it that you are dehydrated, or do you have an infection? Because those
Right.
are the things that affect a lot of sickle cell patients.
And I want to now tweak this into the current situation that we find ourselves in, the COVID-19 pandemic, persons with pre-existing conditions being especially vulnerable. How are you staying safe, Eunice? Have you been staying safe? And what would you say to other persons, not necessarily those with sickle cell, as regards what you are doing currently during this pandemic as regards safety?
Personally, I'm staying at home. I'm working from home. But it's my personal work. I'm not employed, because when you're employed, your employer will not sustain you for more than a month, because with sickle cell, you just get sick anytime. You don't have a time limit like now. Today you'll be sick, tomorrow you'll be fine. But those are the challenges that we face. There is no job opportunities for sickle cell patients. Personally, I'm still believing in God to get a husband, because once I started doing advocacy, I've never gone for a date or for a coffee date. And I believe sometimes sickle cell is a blessing, because without sickle cell, I believe I would have been married long time ago. But because I have sickle cell, there are challenges towards it. And that's why I'm fighting for this right. Today, I was very happy to hear the Ministry of Health say the guidelines are ready. These guidelines, we started fighting for them from 2014. So
Right.
reaching 2020, when we hear they are ready, but they still need to tweak it a bit, and then we launch it, that is a big step for us. And the next step we need them to do is just make sure that I know I'm not answering your question. Your question is COVID and sickle cell. Because of having sickle cell, we usually have very low immunity. So getting infection is very easy. Any person who has an NCD, we are usually prone to infection. So that's why this time we need to stay at home.
Okay, Eunice, I'll come back to you. Let me rope in Dr. Kibet Shikuku, who is a hematologist. He's also the chairman of the Kenya Hemophilia Association. Dr. Shikuku, thanks for joining us on the show. Earlier, rather late last week, the Ministry of Health spoke about a blood donation campaign, saying that in the country there's not enough blood donation currently. And Eunice has talked about some of the challenges that persons living with sickle cell disease face. Tell us why blood donation is so critical for people living with this disease.
That is generally associated with increased blood destruction because the blood cells produced by patients having this disease are abnormal. And so the natural tendency is for the body to destroy these cells. And so by extension, the level of hemoglobin, or the amount of blood that is required to take oxygen through the body, is highly reduced. So that is one challenge. The second challenge is that because of the deformity associated with the cell is unable to move normally within the circulatory system, and so you can get these cells getting limited in terms of movement. And so as a result, one of the things that we advocate for these patients to do is to try and ensure they rehydrate the cells adequately for the cells to then move freely. Secondly, when they're in a crisis, we tend to dilute, or rather reduce, the number of sickle And absence of blood as a country then becomes a risk, not just to these patients, but any other patient that has a low hemoglobin level.
Right.
And so sicklers, by extension, should actually be given priority in terms of blood transfusion when required. I'll possibly mention a little later when blood is also essential as a mode of treatment through a process called red cell exchange. You can actually reduce and taper the effects of this occlusion by removing cells, by passing the patient's blood through a machine. We call it an apheretic machine. You remove the abnormal cells and you replace with the normal cells.
Right.
So that process is called red cell exchange, a procedure that is yet to be adopted in Kenya. But in other countries, people are trying to bring this into use. Congo, for example, together with Congo, together with Rwanda, is actually practicing this. So this is something that we should be doing readily as a country.
And indeed, after listening to the Minister of Health today, we certainly hope that we will be getting the same access to medication here and indeed procedure. But even as we start closing up, Daktari, because the COVID-19 pandemic puts these patients at risk of complications, what would you advise that a sickler does during this period? It's been almost 100 days of the COVID-19 pandemic in the country. How should these persons that are currently living with the disease stay safe?
So thank you, Lillian. One of the things that I know has affected most of the patients in this country is mobility. A lot of patients are now fearing to move around. Nobody wants to attempt to move around because of the risks associated with movements. The second thing is that we expect these patients to avoid scenarios that can expose them to infections by COVID-19. And so one of the things we want to encourage them to do, that anytime they are moving around, they should try to mask, and they should actually attempt as much as possible to avoid crowds. The second thing is that we want them to keep rehydrated. They should take as much fluids as possible. The third thing is that they should try to ensure that they have adequate stocks of their medications. I know that traveling to facilities that provide this care can be an issue, and I think this is where we should try to be more creative and attempt to do some bit of telemedicine. Patients need to understand their doctors better. Doctors need to understand their patients better so that patients can try to reach us a little easily, so that we can advise them to reach and get care at the closest facilities possible.
Final question to you, Dr. Kibet, before I wind up with Eunice. What should future parents know? At least 200,000 children in Africa are born each year with sickle cell disease. What should future parents know? Eunice speaking about challenges in even getting a spouse because she is currently a sickler, or she is living with sickle cell disease. So what should future parents know? Very briefly, kindly.
So truthfully speaking, one of the things that I know has been a big issue is early diagnosis. If we can pick these patients early, that would really help us. And, with early diagnosis, then, early interventions can come on board. The other thing is that even as parents get to learn this disease, we encourage all parents to not just seek healthcare, but to try and live healthy lives. The other thing is, I know a lot of times when parents move around from one facility to the other, they get quite distressed because the problem is that they get treated by being overburdened with medications that may not be necessary. And we've seen this happening in the peripheries. So parents should try as much as possible to ensure that their children are picked early and attended early in a facility that would provide care.
And I think one of the things we are trying to do is to decentralize services and sensitize everyone in our various treatment facilities so that patients can benefit from care that is readily available in our counties.
Many thanks for that, Daktari and Eunice. Today is World Sickle Cell Day, and this year the theme is Break the Silence, Shine the Light on Sickle Cell Disease. Eunice Achieng is a sickle cell advocate and founder of the Sickle Cell Uhuru Trust. She was diagnosed with sickle cell disease at 8 months old. Today, she is 39 years old, and indeed, hers is a story of hope. There is hope indeed, and we certainly hope that the government will continue in making strides towards managing this disease. We also thank our guest, Dr. Kibet Shikuku, a hematologist and chairman of the Kenya Hemophilia Association. Many thanks for watching, guys. Tonight, 10 over 10 is celebrating her birthday. So we're going to let Daktari and